Morning, Ron. Hello, can you hear us?
Hey, good morning, Ron.
Good morning.
Great to see you. Thanks for having me this morning.
Hey, we're glad to have you.
Yeah, I'll just sit tight and wait for you guys to get going, and then let me know when you'd like me to pull up my screen and go from there.
All right. Well, we'll go ahead and get started. We're actually this morning going to, after we do our introductions, turn it over to Mr. Block. If you want to go ahead and start, Molly.
Okay, I'm Molly Peters. I'm the Public Health Administrator.
Beth Burris, I'm a pharmacist, but here as a person with lived experience.
I'm Lexi Coyle. I work with the Crisis Center Foundation.
I'm Annie Dunphy. I work with the school district mental health coordinator.
I'm Amanda Morrow. I am the recovery coordinator.
And of course, I'm Ron Sprung. I'm the community health manager with the health department. So without further ado, we're going to turn it over to Mr. Block to address the council. Welcome.
Excellent. Thanks, Ron. I will pull up my screen and use a presentation just to walk through this. So make sure you guys can see everything. Yeah. You guys see that okay?
Black at the moment. We saw it a second ago.
Yeah.
We'll give it a minute here and see if you guys can see. Let's try that once more. Can you guys see the slideshow?
Oh, no, I'm not seeing it.
And if for some reason it doesn't pull up, I can talk through everything without it. That's no big deal. We've got a small group this morning. We could keep it pretty informal.
And we saw it whenever you were first pulling it up in the
Yeah.
non-slideshow view. There you go.
Oh, you guys have it now?
Yep.
Oh, great. Excellent. All right, well, good. Well, thank you. Yes, we'll go ahead and get started. And first, I'll give you guys just a little bit of background about, me and my role with the Illinois Supreme Court and the Administrative Office of Illinois Courts, and then kind of walk through the action plan that we have developed and recently sent out to all the chief judges and court administrators throughout the state. So just for a little background, I have met with Ron and Amanda and have also met with Judge Schmidt, and we'll be meeting with him this afternoon along with some forensic psychologists from the Southern Illinois University's medical school. So I'm somewhat familiar with Greene County, but work closely with the Department of Human Services, both mental health and substance use divisions, but have had a number of discussions with the super division around ROSC councils and whatnot. So I'm familiar with ROSC councils as well. So I have been in behavioral health for about 20 years now, started my career working with individuals that were homeless as an outreach case manager, and then became executive director of that organization, and had the opportunity then to work directly with our 22nd Judicial Circuit Court in Woodstock, Illinois, where I was the director of problem-solving court. So had developed the mental health court, drug court, domestic violence court, had oversight of the forensic evaluations contract, and then moved on from there to become the executive director of McHenry County's Mental Health Board, where we worked closely with a lot of our justice partners, including local law enforcement, corrections, the courts, and developed a number of different behavioral health and justice programs. And in all those roles, I was active on state level with different associations and whatnot, so really got involved with our state agencies and the courts. And about 3 years ago, the Administrative Office of Illinois Courts, the Illinois Supreme Court, got involved with a national task force to improve the court response to mental illness. And that was under the direction of Chief Justice Burke. And it was a group that was facilitated by, it's called the Council of Chief Justices and State Court Administrators. And that is a nationwide group that essentially picked about 40 people, both judges and behavioral health professionals, really to take a closer look at how the courts can improve what they're doing when it comes to serving those individuals that are struggling mostly with serious mental illness, but then it overlapped into behavioral health disorders, co-occurring substance use disorder, and so on. So through that effort, that group actually just culminated recently with development of a final report and recommendations, and they created over 100 different resources that were fact sheets and best practice overviews, and those are all available on a website that I'll get you later. But throughout that effort, Illinois was a big contributor to that, and that is what led the Illinois Supreme Court to create the position that I'm in, recognizing that if they wanted to make improvements across Illinois within the courts, they needed a singular voice and somebody to represent the courts at the table for both national and state discussions, but also local level discussions. And so I'm involved with any number of projects from, said, at that national level. We have a federal grant that we're operating right now. I sit on a number of different state level commissions and committees with DMH and Super and the governor's office, and then work with local communities just like you guys and offer technical assistance and opportunities to kind of talk through how to improve some of the service systems that you have in place with those behavioral health partners and justice partners. So with that, I'll just kind of jump into the action plan that we have developed. And what you see here is just a brief slide on why we needed to develop a court-focused action plan. And some of the findings here came directly out of the National Task Force, which included just the, probably information that you guys already know about those individuals with serious mental illness really getting hung up in our systems. So we've identified a number of these things that we'd like to look at improving across the state. And certainly everyone's familiar with mental health courts and drug courts. And, the idea here is that is just not enough. The latest research states that about 70% of all people in the criminal justice system have a mental health and or co-occurring substance use disorder. And it's a very small percentage of those individuals that end up in mental health and drug courts. So certainly we need to be looking at how we respond to those individuals across our entire system. So what we did was, through participation in that national effort, as well as throughout the state, we have developed an action plan. This was a plan that was developed primarily with the Illinois Mental Health Task Force, which is a multidisciplinary group of individuals, again, behavioral health and justice professionals, all three branches of government, all the state agencies represented. And these were all individuals appointed by Chief Justice Burke and now supported under Chief Justice Tice. But we spent, obviously, these several years involved in the national effort and have been reviewing research. And this past year, we hosted sequential intercept mapping workshops throughout the state of Illinois. And we also had a community assessment survey, and throughout those processes, we had about 800 people participate and respond with how their communities are doing when it comes to behavioral health and justice partnerships, opportunities to improve, and all that information was essentially rolled up into this action plan. So we took about a year to really develop the plan. And what we've done is we're pretty cognizant and intentional about creating a plan that was not just for the courts, but it is also for communities. So it is a plan for courts and communities to improve their response to behavioral health and justice. And that is just in recognition that obviously we all rely upon one another, and there's so much interconnectivity between our systems that we need to continuously be working together to improve what we're doing and make sure that we understand one another's systems, barriers, wants, needs, and whatnot. So it's really a plan that serves as kind of a guideline, or at least a starting document to help facilitate local discussions around all of these types of partnerships and programs. Looking at the plan, there are a total of 8 strategic goals with 37 recommendations coinciding with these goals. Primarily, the main finding that came out of the National Task Force and their primary recommendation, which we have also promoted here in Illinois, was the idea of courts as conveners of these discussions. As you probably are familiar, there are parts of the state that have very active criminal justice and behavioral health coordinating councils, but that's not true in all communities and all courts throughout the state. And certainly when a judge is the kind of primary leader of these conversations and approaches the state's attorney, defense attorneys, criminal justice partners like law enforcement, corrections, and behavioral health professionals, people start to listen. You guys know that you're up against challenges sometimes when you're the behavioral health community approaching these other stakeholders for these dialogues. But what the findings state is when a judge is the one calling this kind of action to order, people show up and they listen and share. A lot of that came out of Miami-Dade County, where Judge Leifman has been kind of a spokesperson for all these behavioral health and justice programs throughout the country. And he states all the time that it took him, multiple years of convening all of those individuals really to build trust with one another, but then also identify common and shared goals. And, that effort has led to, in Miami now, the creation of this pretty amazing $60 million justice and diversion center, where they have civil beds, they've got crisis beds, they've got a courtroom in there and everything. So it's pretty incredible what they've been able to accomplish. But again, without regular meetings with all of the decision makers and stakeholders at the table, we find that things are just more difficult to accomplish. So the courts as conveners section really is encouraging all of our circuit courts to identify at least one judge, if not multiple judges, in communities like yours where the circuit has lots of different counties, and those counties vary in resources due to rural versus more semi-urban and urban areas. So just this last week, we sent a memo from the Supreme Court to all chief judges and court administrators around the state, asking them to identify a judge that would start to be the point of contact and would start getting more actively involved in some of these efforts. I know, again, Judge Schmidt in your community is a champion for this. So again, I assume he'll be pretty involved in current and future discussions. So, but moving on, we've also identified the need for cross-sector and multidisciplinary training. So a couple of the things that we actually have available right now to communities are, this past year we had about 20 individuals trained in the SAMHSA curriculum, which is how you can improve criminal justice responses through becoming trauma informed. So if you guys are interested in that training in your community, it can be done virtually or remotely. Could be tailored anywhere from a 3-hour training to a full day session, but typically we have 2 trainers that'll come out and meet with your teams and walk through that SAMHSA curriculum. We're also working on a 6-part training series around civil mental health proceedings and the whole involuntary commitment process, because we're finding that there are a number of appeals related to those cases throughout the state, and we have a lot of stakeholders that are just not familiar with the petition certification process, as well as things like involuntary outpatient commitment, which is an underutilized tool and resource in the state. So we'll be providing some training opportunities in those spaces, but also looking at all kinds of other ideas. So if you have specific training needs in that behavioral health and justice space, we would be happy to help try to coordinate those. And then also creating awareness across the intercepts. We find that in a lot of our community groups, we don't have the judicial system or court system represented. And we've done this by leading at the state level, again, by embedding me in a number of those state level agency meetings. And we're hoping that local groups will also continue to try to encourage their courts to be at the tables for discussions with local coalitions, task forces, and so on. So, and then the remaining recommendations are within the sequential intercept model, which I don't know how many of you are familiar with that. Many people have heard of it, but just a quick overview and review of the model, is that this is a model that was created by the SAMHSA Gaines Center in partnership with Policy Research Associates back in the kind of early 2000s, and it's evolved over the years, but it is the model that's been used throughout the country really to look at this continuum of ways that people come into contact with the justice system, and identifies a number of different opportunities at each point in the process where we can either divert individuals into treatment settings or look to treat them with specialized programs within the continuum of the justice system. And what you see here is just the linear model, and some examples obviously that are playing out right now across the state of Illinois are at that early intercept, which is intercept 0. We talk about what services are available in the community, and that includes certainly right now, this is prior to somebody comes into contact with the court system. You have 988 emerging as the crisis line, and then when we move closer to intercept 1 and law enforcement gets involved, the Community Emergency Services and Support Act, the CESA bill, requires the state to be developing mobile crisis response teams, which I think Locust is yours in your location. And this is primarily working with 911 and law enforcement and behavioral health systems to ensure that 988 and 911 systems can intersect, but also that when appropriate, the right responder can go out to serve individuals. So sometimes that'll be law enforcement, sometimes it'll be behavioral health, sometimes it'll be both of those groups. If you're not involved, there's an advisory committee in your region that's meeting to develop kind of policy, procedure, and goals. And if you need further information about that, I can certainly get you all the contact. Maybe you guys already have it. But then as we move further through the intercepts, intercept 2, we see the Office of Pretrial Services and Pretrial Reform, which Greene County is now under the auspices of pretrial services for our new state agency, the Office of Statewide Pretrial Services. And what this means at that pretrial level is those officers can identify individuals with behavioral health needs earlier on in the process and provide that information to the court to help them make decisions about potential conditions or referrals to community-based treatment providers. At Intercept 3, we are looking at reforming, at least reviewing our fitness to stand trial policies and procedures. There's a backlog, as we know, of individuals that wait in local jails while they're to be transferred into DHS custody for fitness restoration services, and we're looking at opportunities to decrease that backlog. Actually, DHS also has legislation that's requiring them to do that. So right now, throughout the year, both the courts and DHS are working together to really assess that entire system and look at ways to improve. And then at the later intercepts, this would be your reentry services, including probation, parole, and whatnot. And there are a number of efforts going on in the reentry space. We actually have a few pilot programs funded through that federal grant I mentioned right now, where we're using peer support specialists to facilitate reentry services and community service navigation, case management, and whatnot. So I believe I've shared some information about that with Ron and Amanda, but we'll certainly share some more. And then finally, what are we doing with this plan is that I mentioned that we have sent this to all of our chief judges and court administrators as of last week. We do have a website with all this information that is shared on there. But on February 2nd at 12:15, we will be hosting a web event to essentially start promoting this plan publicly throughout the state. So I'll make sure that you have registration information to attend that web event. But what we will be doing is following up with local courts, but then also identifying behavioral health and justice coordinating councils, ROSC councils, all those parties that could be interested in this plan as kind of a roadmap or guide for them. And we will offer technical assistance provided either through me or our task force members. One of the things we'd love to do is, if you've not done this in your community, is help facilitate a sequential intercept mapping workshop or discussion. So if you have interest in that, we can certainly follow up and looking at what that could be. And then coming out there and spending, a half a day or a full day really walking through all of those intercepts in detail, and identifying existing programming, emerging needs, opportunities, and all the resources out there that could support improvements at each one of those intersections. So hopefully we can stay involved, obviously, with Greene County and the ROSC Council and our new relationship with Judge Schmidt as well, and see where all this leads. Really, this is not a prescriptive plan. It's not saying do A, B, and C to improve anything. It's saying here are a number of different opportunities, and we're encouraging all the parties to get together, have a discussion about what makes the most sense for their community, and just identify a starting point to work together toward improvements in this entire process. So we hope to see communities engage in that discussion moving forward. And with that, I will stop there and I'll pull down the slideshow and just see if there are questions, thoughts, so on and so forth, and we'll go from there.
Any questions?
I'm sort of curious to know your thoughts on the safe passage program.
Sure. Yes, do. You guys have a safe passage in operation in your community?
We do not.
We don't, but
You don't. Okay. Yes, I was in McHenry County, which is an interesting county, which is kind of semi-urban, semi-rural, depending on where you are throughout the county. Was part of the development of, we called it a way out here in McHenry County, but it included, I think, 22 municipal law enforcement agencies that were interested in participating, and then obviously our state's attorney's office, and then our local substance use providers. And probably the biggest issue that we ran into with that program in the beginning was lack of access to immediate treatment. There was kind of a preconceived idea that anybody that would walk into one of those police agencies looking for help would have an automatic transfer to inpatient treatment. So there, after that kind of caused some stall in the process and some confusion, we had to get everyone back at the table and talk about levels of care and allowing a direct, essentially, contact with a substance use provider to provide an assessment first and then determine level of care. So it ended up that, to bridge the gap in some of those individuals that might have needed inpatient levels of care but didn't have immediate access, we developed a contract where we had a recovery system organization like a ROSC council made up of peers actually provide kind of recovery support services and whatnot in the interim. And then we really did have to rely on outpatient programming. And one of the biggest issues that most people ran into was just safe, secure housing in the community. So, overall, they've seen a lot of success here. Lake County, there are a handful of these programs around, but I think you just really have to kind of tailor them and alter those to the resources that you have. So if you're looking at that and you don't have immediate access to inpatient, you just have to really consider, how quickly you can provide an assessment and then link somebody to outpatient care along with maybe some extra recovery support services of some type while those individuals would be in IOP or PHP or medication assisted treatment, whatever it might be. So that was kind of the McHenry County experience that I had. But after it was up and running, law enforcement really, started to embrace this because they were seeing some improvements in those individuals that, you know, they would run into pretty frequently out in the community. So we were also fortunate to have really, really strong support from those recovery system agencies. Like, again, we've got one called New Directions that is all individuals that are in recovery that started some sober housing programs and whatnot. So that group really rallied around to make the program a success. But overall, we've heard positive things about these programs throughout the state. Unfortunately, there's no, no inventory of all the different counties that have those programs. That's something we've been trying to get right now too, is there are so many different states attorney diversion programs and safe passage programs, but there's no one body that kind of keeps a list of all those. But should you want to have any discussion with another community or county that has started one of those programs, I'd be happy to help find one. Maybe to connect you guys with to talk through some of their experiences too.
This is Molly, and I just had a note just about the recent information. You mentioned 988 numbers and the ability to contact 988. I think there definitely needs to be more conversations with law enforcement and EMS on that number and the resources to get somebody there who has experience in mental health and recovery. Just an example was the EMS recent and how important it is to start staffing 988 and really develop that more. And I feel like that's a strong need, and we really need more education in law enforcement. That number. Even now, we've communicated with our law enforcement and our court staff about 988, but there is still going to be failure to call to just increase that awareness and understanding through the court, I believe, and utilizing that and educating our judge and all judges that should be utilized more.
Absolutely, well said. And one of the recommendations actually within the action plan is to ask all courts and probation departments to provide 988 information, flyers, brochures, whatever it is that we can provide for them to just have available. Court clerks also, we're asking to have that information available at their service desks. And I represent the courts on the 988 CESA expert consulting group right now. And within that group, we've got all the 911 PSAP regions represented, as well as the executive director of the Sheriff's Association and Chiefs of Police Association. But regardless of all that, there's still a lot of misinformation about 988 and CESA, really, which is probably primarily causing most of the confusion. The Community Emergency Services and Support Act really is 988 is just the number, it's the crisis line. CESA is what requires 911 to interact with 988, and then also requires DHS to have those 590 grant mobile crisis response providers available throughout the entire state. Now, legislatively, DHS just requested a delay in implementation, so they have until July of this year to complete that process. And the 11 regions that I spoke about are the PSAP regions, which are the public service answering points, and those are led by E911 agencies and law enforcement. And within each of those 11 regions, there's a multidisciplinary group of individuals appointed to look at their region and develop the policies and procedures that will connect 988 and CESA and 911 services. So if you're not involved with that, those are open meetings because they're facilitated through DHS, so everyone can get involved with those. They've got a CESA website on DHS's page, and it provides information about all the next meeting dates and whatnot. So again, I can follow up if you don't have that information yet and send over a couple resources for you guys to look at after the meeting.
Yeah, that would be wonderful. Yeah, we would definitely be interested just voicing the needs.
Absolutely. Yeah, there's you know, it's interesting. So there's for this entire project, there's an advisory group that was appointed directly by the governor. And that's like 18 people, you know, representing all these different state agencies and associations. And then because the state varies so widely, that's why they broke it into these 11 different regions, trying to coordinate, you know, based on resources and whatnot. And so although they're all under this overarching legislation, everybody's going to have like their own policies on things like a response time and that sort of stuff. So it's interesting how it's all breaking down, but absolutely get involved in those discussions, because it'll be the opportunity to share what you all do and also look at how that can add to, you know, that entire process. So that's all kind of in the works right now. So we'll make sure that you guys have that info.
Perfect, thank you.
Any other questions for him? All right, thank you, Mr. Block.
Absolutely. Yeah. Hope to catch up with you guys. Like I said, if you're interested in, you know, an actual sequential intercept mapping workshop or facilitated discussion around that with all the partners, you know, we encourage the courts, the probation office, law enforcement, everybody to be at the table for that. I'd be happy to help facilitate that. So Ron and Amanda, hopefully we can follow up.
Absolutely.
Yes, thank you.
Thank you.
All right, I will send you guys an email. Feel free to share all those resources, and just consider me also a resource here for any information that I shared today and anything else you might be interested in. So thank you guys for the time, and we'll stay connected.
So kind of piggybacking on what your question, is developed an overdose response. It's like an action plan, and it's a 5-year plan. In that 5-year is a safe passages program.
Cool.
So that's something
I
that's
should have asked you guys
definitely-
first, but he's right there.
Yeah, no, like that's something that McCoupin and Montgomery have an amazing passages program out of their health department. And that's kind of where the idea started to, you know,
Yeah.
trickle in. So it's definitely something that's on my radar.
Some other place they have one too. I actually interviewed some police officers about it because I was just wondering, like, is that actionable? Is that feasible here? And Kale was like, we have one person at the desk at the police department. Like, somebody came in, like, there's just one person there. So, like, but people would support it. So, yeah, and like what he was talking about, there's just some logistical.
There is
some
logistics.
special.
There's some RCOs that are starting to operate in the area, and that could be the supplemental need that we have to fill for short term in the short term interval.
Yeah.
So exploring. So I wanted to go over some of our updates. As you all know, we've been working on the stigma campaign. Amanda recently put in all of the libraries in Greene and Scott some displays. The library, she donated the books about recovery and mental health, a bunch of information about the council out there, and I think it's going pretty good. I think that people are very interested
I wanted to read
and
those
engaged.
just to check. I thought the display looked really nice. I thought the librarian was super supportive.
Oh, yes.
And, you know, they put it in a place where there were other, like, information, so, you know, so you could, like, take help without really being super obvious, but it was right there. And I thought that was.
Proud of her for that.
They all took Narcan too. So
Good.
every library did.
That's not an easy task to conversation, and they were very receptive. So.
Yes,
Well,
all
you
of
don't
them
even
were
think
great.
about that, but there are a lot of people.
And a lot of them were right next to a park.
Exactly.
So,
In situations like that, you never know.
yeah.
Right.
And they're open at times, and that's where sometimes somebody might run over there.
Yeah.
So, and a lot of them wanted
and to keep library.
There's
So,
definitely activity.
yes. Yeah.
So she's done a great job at trying to get the word out, and we're looking at ways that we can.
And are you giving some people come in to you too, to like rent some out from you individually?
Yeah,
too?
we're going to order some more too. Yeah, and I think I'm wanting to talk to jail.
What's at that library? That's like a borrowing. There, can they take?
I think
I just, just like you normally would, check it out and then.
but they've updated like quite a, I mean, there's good stock.
Well, then I think they're going to rotate within each other, so then a little bit and then maybe, switch.
Yeah, the logistics of the library are kind of complicated, so the only way that we could get it done was to donate them. But something was that the libraries have a network,
Oh, yeah.
and then they switch the books out. So that's how they're going to move the books, so that the books are constantly rotated. It's just one of the little that we can try to reach more people. So recently, we've been working pretty hard on trying to build the infrastructure. Need or expressed most by the recovery community is the lack of support in this community. So Amanda has put everything into this program. I think the program itself is called Guided Paths, and it's a peer-based support. So Lifting Spirits, which is a recovery support group at the gym. So it's just a non-traditional way that she can get people moving, because exercise is part of somebody's recovery if they can incorporate that.
And it
into
can be any kind of recovery. Like it can be people, because the reason I ask is, I've had some friends that, seasonally,
Right,
like it's just very difficult because they're just affected by the winter.
Right.
That would be, or is it more substance abuse?
No, anybody, mental health, anybody, is welcome. to
We
join.
talked about that, and one of my concerns was the side of things. The prevention side kicks in for substance use, because if you let that go too long, it can spike. And then at least that we can try to
Yeah, I think that's excellent.
get more people involved. So she's also going to do Guided Paths, which is a non-support group. In other words, I'm only available at 2:00 on Wednesday. I can just walk in and spend an hour doing this or whoever's there. So it's like an open door support group, not a structured time. So if somebody doesn't want to come at 1, they can come at 2:30. They can. But it gives them the opportunity. It just kind of opens that door a little bit more.
And those are at the high school.
That's going to be at that health department.
Oh, that's a high school.
That's going to be at the health department, Carrollton on Wednesdays. And then on Thursdays, more individualized one-on-one support. Because one of the things that in her work is there's a lot of people out there that don't want to talk in support groups. And more doing the same thing that you do in a support group, but on a one-on-one basis is what several people have said is a desperate need. In a way, because clinical services are radically different than peer support services. So we're going to try on Thursday afternoons, this office. 1 to 3. We're open 12 to 4, but 1 to 3.
Yeah, it feels like the individual sessions, it's kind of like where they can ask anything.
Talk and
Yeah.
And
So
it can be any issue.
I mean, anything like, we're here to try to coordinate the network. That's the point of it. Maybe there's an opportunity for us to connect somebody to something they really need.
Like, grief support or family issues or.
Absolutely. Absolutely.
needs like hygiene materials. That was something that probation talked about. Is that they need just somebody to sit down and talk with individuals about things they might need that they don't be that kind of support for them.
How do we get them to know it's here?
So we've been working really hard at having individualized conversations. And that. So one of the things that we've been discussing with different members of the council is, with outreach materials. People see tools like this that are used in outreach materials. So one of the things that we talked about with some council members, instead of doing this for the council to get the council's name, this is what we focused our attention on. So resources that people need, and we can put it where it needs to be. So one of the ideas we have is to put bags like this, hygiene items, and then place them all across the county. Police departments, schools, you name it. Inside of it, it would have resources from the council, peer support, the MAC clinic, mobile crisis in Scott County, you name it, those resources would be in there so that we can. So,
Is the MAC clinic in Jerseyville?
so the MAC clinic is both Jerseyville and Root House. It's on the first and third Tuesdays.
I think there was some time where they were asking people to go to Jerseyville.
Yes.
I think there's been some communication in Jersey, just the need for them to be present here. So I think that's something.
So are they here?
They are. And one of the things that I brought up, there's a CARES consortium, and it's a group of partners, including us. I represent the health department at the CARES consortium. It's just like an intro. And they, it was for some time, started offering appointments in the Root House office.
At the Illini?
At the GCH Medical Clinic. Yep. So, appointment, you don't have to be a patient with JCH, you just call, say you need an appointment with Matt. But brings me to the next thing. So in here, you have a little letter that I included in everybody's packet. What this letter does is changes everything, and it's recovery. On December 29th, they removed the waiver. The waiver, it just essentially said this doctor can prescribe and they can only treat patients. Why that was put into place, why that was put into place, I don't know. But that's no more once this, and it kicks in later this summer. It takes effect on June 21st. And that means that doctors anywhere can prescribe.
I just never even understood that class X for that medicine. I did not get it.
And what we want to do, everybody here, spread the word. When you talk to them about it, get the word out. We're going to be working really hard to make sure that everybody understands that this is a thing.
MD, PA, NB, everybody, or is it just?
It's entirely restriction altogether. So if you can now, my understanding is if you can write a prescription, VA number, you can write the prescription as if it was anything else.
That's really big.
That's huge.
That's really big. I mean, sometimes I worry that sometimes we get sort of given a credential and don't really have what they need to use it. I don't know how else to say it, but I mean, we just don't have anybody to treat anybody.
Right.
You know,
Right.
hopefully.
And remove some of those, more of those barriers, you know, so that enables us to hopefully reach more people. And have those, a lot of times, like, you don't want to call you don't want to call a clinic. The relationship with the provider here in your house, you now have that opportunity.
And
to
just educating people, because it's so hard to do by yourself, once you mess up your brain. I mean,
It is
you
the
need help,
bear.
and some people can just do it through counseling, but some people substance stuff
Right.
like that, at least for a period of time.
Absolutely, it's just. It's a great country that we just need to continue with their embrace. It's a medical condition that can be treated with medication.
Right.
So then, that goes across the board, medications that they can give, their opioid medications they can give, so this is huge.
Yeah, and I hope we can take the stigma away of some of our providers too.
Yeah, and
Because
that's
they're just like,
Yeah.
something else to, it's
Yeah.
like, no, that's not the way.
Yeah.
That's infuriating. It is. Education, I think
Yes.
it's education is.
I'm just like the stigma around mental health and substance use and all of that stuff. Yeah.
It's no different, I wouldn't say, well, I'm just, so upset that I've got whatever, diabetes or anything.
JCH in Jerseyville, and my little desk was in the Mac Clinic office. It was really interesting to like hear people's stories and see, all coming in. Like this one guy, I remember, he was like, I did manual labor for so long, and the doctor just kept prescribing me opioids for my back pain for like or something. And then he's like, it ruined my whole life. Like, but my back hurts so badly. So then I had to make a decision. Do I want to just live with the pain in my back and come here and do this?
Yeah.
That's like not what people necessarily think of when they think
It's
of
not.
back clinic.
Yeah,
But
it's
there's
not.
all different people that have been impacted by that.
Something that can save people's lives.
Yeah.
And
I think if you guys hear that our people aren't being served in the community itself and are asked to go to a different treatment, I think that's an important thing that we need to communicate as a team group, as a council, just because then we can more advocate for people being served here. And I think that conversation, so if not being.
What would the process be to get someone to, what's the first one called?
call us.
Yeah.
Okay.
Make sure people are here, and if that doesn't. Call.
Yeah.
Yeah, for sure. So we're going to keep working on that and spreading awareness about it, because I think that's huge. It changes.
You have come what year? I'm gonna cry.
No.
Because, I mean, seriously, after 40 years of fighting, that, we really had about nothing.
We're gonna keep pushing. We can reach a lot more people by doing this, especially in Scott County. We have a MAC clinic. They do not. So I mean, that's huge. So,
There's also a mobile Mac clinic. That's gonna
and
be-
yes, and that's something we haven't told anybody about yet. But there is a mobile MAC clinic that was council, which is out of the Sangamon County. They're going to serve Greene County. So we'll be having a meeting with Andrew. He's the leader of that does it, and we're going to see like what it entails. So
Is there like a provider
on the bus? Yes, yes. They purchased it with grant funding. I think it's similar through the JCH clinic, but it just is on a bus. So
Cool.
huge.
That's awesome.
So from the last meeting, if you approve them, I will need a motion to approve to submit them to the state. Ask the council.
I'll motion to approve.
Second.
Those in favor?
Or I,
motion is adopted. Other things that we've been doing, of course, the hygiene support and our next impressions. We did have a minor setback. Water main that exploded here.
Bad,
It was bad.
really bad.
We got it. We got it pulled back together and things are up and down. I'll take you guys back there whenever we're done, so you can see it.
Field trip.
And then, like I said, the hygiene items, if the council approves us, we need a motion to approve to purchase all of those hygiene items.
I love that idea. I'll make the motion.
So many people who don't have kids, like, we have stuff like that at school and they come sit in my office and I'm like, do something.
Yes,
And they're
absolutely.
like, okay, like a toothbrush, blankets, just like, y'all should come to parent teacher conferences. Have you ever done that before?
Mhm.
And like, parents that you need to talk to might not be there.
Right.
But so many other members of the community
Let's just
are coming through there, like.
Yes.
to talk.
And,
I mean, yeah.
and that was my next question. How can we reach more people? I know we're getting tight on time, but how can we reach more people? I think we've come light years in a very short period of time.
Absolutely.
But to me, there's so much more to do.
Well, it's
I feel like we haven't done anything.
Where did they go? Ball games. I mean, I don't know. Would you ever?
Well, and you know, one of the things that I did see recently is another, because you can't be everywhere all the time. They started purchasing, you know, the little banners that they have at ball games and stuff. They started putting their name on there with their phone. And people are sitting in the stands staring at it. So I mean, that may be something that we can, just so that we can get it out there.
Well, I mean, you try to think.
I feel like people with high school sports.
Yes.
Yeah.
Way more so here than we're in problem, like, whoa, this is still a thing for like.
I mean, if you just kind of.
I know.
Right, at a basketball game. I mean, I'd be willing to sit with somebody and just. In a bag.
Well, and
Bags and stuff.
we may need help, you know, the more things we're able to do. So, I mean, that may be something that we explore.
And teachers too, like, talking with them about all this stuff, because they have a pulse on everything that's going on. you know?
Even if it was like a 15-minute during your teacher institute day,
Yes, absolutely.
that would just be very.
A shelf in the school. I mean, just have something like a place where the teacher can go. Like you said, get some deodorant or get.
I think it would be helpful to start with. Understand. So like if you brought this to a basketball game and you had Narcan, let's say you had Narcan, then they have some understanding of what it is. And then it's okay. You know, whereas if you show up and then there's all this stigma about it,
Mhm.
And you have
starting
to-
there might be really good.
You're not gonna hand Narcan to an 8-year-old.
Yeah, you have to use common sense in some certain situations. But that is an idea that signal other councils.
School, I think that'd be probably, that's a, and teachers.
Start there.
More
They know all
And putting these resource
Arts
cards like in the
everywhere.
bathrooms at the schools. As the kids
There is,
could
yeah.
pick one up without anybody even knowing.
Yeah.
Too.
That is something some of the other councils have been doing, is just slipping them in.
Well, your reach there at the kids level too is like, there are kids that just need somebody to reach out to say, I don't know what's happening at my house.
Yes.
Mhm.
And it's that as a card.
And they could
like,
just put it in their pocket
Yeah.
too, you know, if. so
like,
that
I don't
nobody would know.
understand.
Do they have any programs? I know my kids were getting ready to leave. So they were trying to get back. Weekends, kids that, they basically when they're in school.
Yeah.
And then they had a backpack and they took. Do you have any program?
I I don't. Food. I know the clothes are sent home every semester with the homeless students. But I don't.
What campus are you in?
Both. So I'm 3 days at the elementary school and 2 at the high school.
I know that was something they were trying.
Done it in the past. But
I know
think-
with the McKinney-Vento, like the big homeless grant, there's a lot of money there, so I wonder if that's just, no, I can try to talk to somebody about that. see if
I
they
know that there was a need, but I mean, my youngest graduated in 2012, so it's been a while.
Yeah, I mean, there's definitely a need for it, like.
What we're going to do as we move into this year is partner with the food pantries and go there and work with them so that we can have individualized conversations with the people. There's ways that we can slip our information in bags. Maybe they don't want to have that discussion. They go home and read it, and maybe we can have a broader impact.
Situational, everything, situational depression.
Yeah.
And the money, you have no food, who would be in it?
Absolutely.
I mean, versus, it's just all different.
I agree wholeheartedly. And that's kind of like what we as the health department are trying to do, is trying to address the social determinants that determine someone. And that's kind of how the council itself blossomed.
I think too, that like individual time that you guys are talking about, in terms of like a 5-year plan, could be really good. Lead into like groups, like I think maybe this community's not ready for an open
Yes.
conversation, so like that's a really good first step.
We found that out. Didn't know how ready they were really. What we came to, we had a overdose training right whenever, and we had 3 people show up. In that conversation, we're like, why aren't there more people here?
Mm-hmm.
And what came out of it was, they're just not ready. So instead of us doing like attending like the park events and whatnot, it's more having individualized conversations, because you can break the stigma. Obviously, versus people walking by you. So
And find like those 10 people who are willing to have open conversations about it.
well, and that's kind of the outreach and communications plan. We are right in here. We're finishing up the analysis of our community needs. Our community needs assessment. Carrollton's, past or memorials, voids, JCH, the health departments in the region, and putting it into one collective community needs
That's good.
assessment.
So like we're all like working together. Sometimes it's like a stigma between. Hospital, and my husband worked there. It was like there was some fight, and it's like, come on.
Well, and we had a conversation recently with an organization that's very siloed manner. And if we're going to fix these problems as a community and drive economic development, investment, educational opportunities, going to do that is we stop that siloed nature and move forward together.
Yes.
So I think that that's something I know Molly leans very
Yes.
heavily into.
Well, in anything, I mean, because money goes like where boats are. And if we're, a group of 2,000 or for a group of 20,000 or whatever, it just.
It does, yeah. I mean, you're right. So it's very important, like the work of this council, the work of the other programs and stuff we have in the health going on in the health department. They're absolutely, we have to have engagement. We have to break down the silos. Something that I know we're going to do.
And I think for the needs assessment parts, like the community eye plans or the hospital done, is to conduct that because it's required and then file it away. What we do is really reconsider it. And I think if we can work with the hospitals in a different way, that we're really focused on these scenarios. So hospitals might find cardiovascular disease as a high need. finding physical activity as a high need. So that's something that we need to coordinate better.
Yeah,
and
for sure.
Work it out. So that's something that we're.
Seriously,
Something
getting
we're trying
things done.
So we're moving into our strategy kind of plan where we have to develop a 5-year strategy. On at 4:00 at the health department, there's a strategy planning meeting where we have more of the discussion of this is what we need to do and this is where we need roundtable discussion. We'll have other high-ranking officials from Greene County in attendance. So I encourage everybody on the council to come.
31st,
31st at
4
4:00.
p.m. 4
4:00
p.m.
at the health department in Carrollton. So
Yes.
it's anybody and everybody's welcome. So we'll begin those discussions shortly. Did anybody else have anything to add? Well, we'll end the meeting there. If anybody needs anything, don't hesitate reaching out to us. I believe that's all we really, that's all we had for you guys today.
Thank you.
Thank you.
Oh, and we're in
Yep, we're doing
Yes,
our
we're gonna-
We'll have that